All right, so I want to talk about a scenario, okay? And this is actually one of some of the mistakes that could actually occur during imaging. Okay, I want to image a particular part of the body of a patient, so some one or two issues. So I want to look at the effect of a patient shaking their hand. Maybe when there was an imaging for the hand ongoing, then they shaked it. So I want to look at how the image will look like. So you can see how the image is unclear. So we call this what is known as a fuzzy appearance. So this actually shed more light on the importance of, if I want to image a patient, the patient should be stable. If they're not stable, I could actually use something that could actually make them stable, you know. So let's just discuss the scenario. So that when the forearm radiography shows a fuzzy or blood appearance, because the patient has moved during the exposure, it's actually described as what? Motion artifact. Okay. So why it happens, the patient moved. Okay. When they were being exposed to X-rays, they moved. Or probably on the operator side, maybe they exposed the patient too much, you know. Like the patient was there for too long, they were uncomfortable, then they started moving, you know. Then poor immobilization. So if the forearm isn't properly supported or restrained, probably it wasn't the will of the patient to move the arm, but probably the arm wasn't held properly and fell off or something. Okay. Fuzzy. You can see that this appearance is kind of like neat. This one is fuzzy. Okay. Fuzzy. This one too is fuzzy. You know. So there's lots of sharpness and details. So the edges of the bones and soft tissues appear blurred, you know. Structures may look doubled or smeared, you know. So immobilization, you can, to improve this, you know, you can use all those sandbags, you know, or, you know, positioning aids to help you, you know. Communication, you have to actually be open to the patient. Hey, please don't move, you know. And you have to be accurate in everything you do so that the patient is not bored by being there for too long, you know. So if it's patients that children or patients that are restless or psychiatric, then you have to bring everything in so that you can be able to hold them in a particular place and all. Okay, so this is what we got for fuzzy appearance images.